Welcome to the Eye on Annapolis Local Business Spotlight. There are thousands of locally owned businesses in the area, some small and some large. Some you may know and others you don't. But one thing they all have in common is a great story, and we want to share it with you. Join us every Saturday as we talk to the founders, the owners, and the managers of local businesses you have come to know and love, and those you will come to know and love. Now here's your host, John Frenay, with this week's Local Business Spotlight.
Well, we made the trip up here to Glen Burnie to Crane Towers, which is, I would say, in the shadows of BWMC, but you're kind of competing showers, but you're just around like shadows. You're just around the corner. But here with us today is Dr. Britney Ometz, who is with Anne Arundel Audiology. And she's not just with us. She is the name face and the person, I understand, who built the furniture.
That's right. I did it all.
Hey, congratulations on being in business. And before we started recording, you said you had just opened up about a year ago.
That's right.
Anne Arundel Audiology, and that is the website. It makes it real easy. AnneArundelAudiology.com. And as I said, it's right here on Crane Highway South, just sort of kind of in the area of BWMC.
That's right.
In the most basic sense, you're a hearing specialist.
Yeah.
And you make people hear better.
Mm-hmm. Yep.
How did we get into this?
That's a great question. So I actually decided on audiology very early on. I took sign language classes in high school. And at that time, we had to complete a presentation on careers that may use sign language at some point. Audiology came up and I said, hey, that looks great. I get to help people. I wanted to be in healthcare in some way. And so I just ran with it from there.
Wow. Oh, do you have any hearing issues yourself?
I do not, but I have people in my family who have pretty significant hearing loss. So I've been around it my whole life.
Okay, so you probably lived the life that my family lived with before I got my hearing aids.
Yeah.
What? What did you say? So you really sort of had this desire since high school to get into this.
I sure did. Yeah, it's, my grandfather, especially growing up, you've seen it in other people. When you can't hear, they have a glazed look on their face. They're not really engaging in conversation. It's really hard to see that. But over the years, as he's had better hearing aids, he's really been able to enjoy conversation with family more.
But it's so funny. I just saw over the holidays, I saw a picture of the first cell phone, and it was this gigantic brick that was on the side of the head, and his antenna sticking up, and looked so ridiculous as to what we have now. And as the hearing aids and the technology develops, they literally have some hearing aids now that are truly invisible.
Yeah.
Unless you're examining the inside of an ear.
Yeah, they have, hearing aids you used to have to wear. They were body worn. It was a box that you wore.
Oh, wow.
Yeah, a box that you wore and with sort of like headphones that were on. And then they've developed and gotten smaller and smaller. There's the big buzzword, AI, artificial intelligence in them now. But there are different styles. There's the really teeny tiny in the ear ones. Even the ones that sit behind your ear are fairly small and can be relatively invisible, depending on the length of your hair.
Sure. And the colors of the hair and everything else.
Exactly.
And one thing I will say for those that are listening that may be a little bit short of hearing, and coming from experience, if you're worried about people noticing it and seeing it, they don't.
No, that's true. They really aren't looking. You really have to be looking in someone's ear.
Once you have them, you will absolutely notice everybody that does. But
Yeah.
the example is when I first got mine, my girlfriend had realized that I was going to get them. She knew I was obviously had the appointment and everything else. And it was 4 days later that she first noticed.
Oh, wow.
We had gone out to dinner that night, and I'm hearing birds that I had never heard before, and the whole 9 yards. And she said, well, when were you going together? I said, well, I got them like almost a week ago. She says, oh my gosh, I did it in the same. So there really is the stigma is almost gone, which is really very cool. What services do you offer? I know I've got a friend of mine that has a cochlear implant, which is a medical procedure, and I don't know if that's something that I don't think you get into. I'm going to assume that you may not get into, but you may refer into something like that for different types of losses, I guess.
That's right. Yeah. So I primarily complete hearing tests and work with hearing aids, work with people who have tinnitus, or you may have heard tinnitus. That's the ringing or the buzzing in your ears. That's my main focus. As my clinic grows, I'll integrate other services. But when someone has a very profound hearing loss or they seem to be a candidate for a cochlear implant, that's when I would refer out to a clinic that specializes in that. It's an entirely different sector of audiology. There's so many different parts of audiology that you can do, but that one's more specialized.
For the implant, I mean, that's surgery, isn't it?
That is surgery. Yeah, it's a totally different way of hearing. So it's using electrical stimulation in the inner ear to send the signal to the brain, whereas a hearing aid, you're still using your natural ear. You're just using it.
That's so weird when you think about the signaling to your brain. And you mentioned AI is a big buzzword. I mean, how does that play into hearing loss?
So the way they're integrating it into hearing aids themselves. So the hearing aids are making the decisions for you in the environment. If you're in loud noise, are you in quiet, listening to music? And then it's also now there's these cool apps with your hearing aids. So you can hit a button and it will scan the environment in that moment and make an adjustment as well. So it's doing the thinking for you. In the past, hearing aids, you often had maybe a button that you would press to tell it the environment that you're in. Now the hearing aid's doing the work for you.
Oh, very cool. Well, so the services that you provide is somebody that is marginally hard of hearing to probably pretty severe hearing. I mean, how much of a correction can a hearing aid make?
It really depends on how much hearing loss you have and other factors. So when we're completing a hearing test, we're not only looking at the volume, how softly you can hear a tone, but it's also the clarity of speech and your ability to decipher sounds or words in background noise. There's multiple components to the test.
Okay.
So I actually even work with hearing aids with people who have technically normal hearing. So we're not just looking at your results, but also subjectively how you're experiencing the world around you and the difficulties you're having. Someone with a mild hearing loss may feel extremely crippled by their loss, whereas someone with seemingly more of a hearing loss may not realize they have it because it's happened so slowly over time.
I mean, okay, I'm going to say my hearing loss came as an adult. I mean, I know exactly where it probably stemmed from because I worked in a nightclub for 5 years,
Right.
5 nights a week, and I didn't even think about possibly putting anything in my ears to protect them. What ages are you seeing as a professional seeing the hearing loss?
So of course, I test kiddos 5 years old and up. And the age where you really start to see age-related hearing loss related to noise exposure is really about 55 for men. Women tend to develop hearing loss a little bit later, but you should be getting preventative testing around 55 years old or anytime you think you might be having difficulty.
Well, your hearing loss, I mean, hearing is a degenerative sense, I guess. That's the correct word. I mean, just
Yes.
naturally as you age, I know that your eyes do not work as well, whether that you have readers like I've got or, you've had surgery or something. Hearing, I would not expect the hearing of a 1-year-old I would expect that to be a little bit more sharp, understanding a sign than a 70 or an 80-year-old. Is that accurate?
That's accurate. I mean, outside of, different syndromes or conditions that may be associated with early onset hearing loss in children, everyone is going to have a decline in their hearing over time. The rate is different for everyone else. There's different factors that come into play, but yes, as you age, your hearing will decline. Treating it sooner than later will slow down that progression though.
And you mentioned tinnitus, which I've never experienced, or tinnitus.
Yep, both are correct.
And that is a ringing in the ears. Are those the two types of hearing loss? Is just loss and tinnitus?
So tinnitus or tinnitus, you can say either, that is a separate symptom. And that is, I said a ringing because it's the most common for people to say it's a ringing, but it's really any sound that you perceive that's not actually in the environment. So some people even perceive the sound of crickets or a roaring sound. They may hear their heartbeat, but it's not in the environment, but you can hear it. And a lot of people often say it's worse when you're in quiet. Hearing loss is separate from that, though they tend to go hand in hand. So if you have hearing loss, it's not uncommon to have tinnitus as well. And that's often because it stems from the damage in your ear that causes hearing loss. So what causes hearing loss can also cause tinnitus.
Interesting. Interesting. Now, you are an audiologist.
I sure am.
And you are a doctor of audiology. Is that the proper term?
That is, yes.
So what was involved in that? I mean, obviously we graduated high school because that's where we that's where we figured this out. You've obviously gone through school and learned all about the ear.
So you get your 4 years of college, you get your 4 years to get your doctoral degree, and throughout that, you're completing clinical training. So yes, we're doing the hearing test and we're working with the hearing aids, but there's also other conditions that audiologists work with, the vestibular system or your balance. So people who have falls, we do the testing for that. Cochlear implants, which you mentioned. Some audiologists work in the school system with children.
And I did notice on your website, and again, that's Anne Arundel Audiology.com, that you take insurance.
Yes.
Is that a fairly new thing in the industry? Because I know at one point I had heard that the only insurance that is covered is something like for veterans in the VA.
So insurance is I could go on a long time about insurance in this field. So stop me if I get too far into it. But insurance has generally covered a portion of a hearing test, especially if you come in with a reason. Hey, I think my hearing's going down. That's medical necessity. We need to see if you have hearing loss. So insurance typically covers a portion of the hearing test. Hearing aids it's up in the air. So some insurance has partial coverage, some doesn't even touch anything, no coverage, and some can cover full, depending on the technology level that you get. What's happening now is that third parties are being introduced. So that means now there's a middleman between me, the provider, and you, your health insurance. Things like True Hearing or United Healthcare Hearing. So how this is changing is they're presenting it as a discount plan. You can get your hearing aids at a lower cost, or the only way you're allowed to use your benefit is by going through them. Positive is, yes, sometimes the hearing aids are at a lower cost. The negative is sometimes they dictate the products that you can get. So the best one for you may not be available through that third party. But you can only use your benefit if you use them. So you're missing out. It's getting really challenging.
It's a catch-22, and that sort of begs the question too. Is I know that there's been a recent law that says that hearing aids must be available in over the counter, where it used to be for lack of a better word, a prescriptive type of a device.
Right.
And my thought on that is, I don't want to go to Walmart or Costco. I want to go to somebody that is a professional. I'm dealing with a sense. I need to know that the train is coming down the tracks heading toward me to get off of the tracks before the train comes down. And I do not want to trust that to just somebody that's saying, oh, yeah, let me hook you up to this machine and see. Yeah, it sounds like you need the Model 3. Here you go. And I don't know what the procedure is in those things, but I think that, there's such value in dealing with a professional such as yourself. As I mentioned, I had LASIK done on my eyes, and, you work with the professionals that know this, that have seen the issues. And I think that's a really critical thing, is that, as we come to somebody like Dr. Ometz, you've seen this and you know this, and you say, okay, well, this aid might be perfect for you, but you may not be able to hear such and such. And, you can really balance it out and consult with your patient to be able to sit there and say, what's going to be best for you in your life and your lifestyle, as opposed to, I just find it hard to believe that I can go to www.makemehear.com and, this thing's going to send a couple beeps through my speakers, and next thing you know, Amazon's rolling up to my door with a box.
Right. No, you're so right about that. The over-the-counter, it was a great idea in terms of creating accessibility, but now everyone's using Dr. Google, right, to self-diagnose. Well, what if it is just earwax? Now you've not gone and seen a professional. You could have just gotten your ears cleaned and you never needed a device, and now you've wasted your money. But a big issue with over-the-counter is it's not appropriate for many people. It's only supposed to be for those people kind of getting into the world of hearing aids. Maybe they don't need one all the time and they have a mild hearing loss. If you have anything more than that, it's not doing it for you.
What defines mild versus middle versus severe hearing loss?
Sure. So it's how loud we have to make the sound for you to perceive it. So as the only way to determine your type of hearing loss is to complete a full evaluation. And so when we're looking at what we call an audiogram, we're looking at how loud did I have to turn that up for you to be able to hear it? And we're doing that at different frequencies. So if it depends just at the decibel level, how loudly we have to turn it up, how we define your hearing loss.
Stepping back from it, you said that hearing will change over the age of lifespan of a person. You can adjust hearing aids, correct? As that, and that's something that I'll jump back into dealing with a professional. That you're going to deal with somebody that is going to want to maybe check up on you again and say, "Hey, how's it working for you?" As opposed to, I don't think that you're going to find www.makethehear.com now calling you back saying, "Hey, how's it working for you?" And having the ability to say, "Well, I'm not, when I go out to dinner, I'm having a real problem." And that way, I can come to a professional and you say, "Oh, well, okay, we need to adjust." You talked about frequencies and highs and lows and everything else. I think that makes the argument that you do need to deal with a professional when you're.
Well, that's true. A lot of people, when they're looking at over the counter, they're excited because the cost is so appealing, right? $250 for a hearing aid. But that's not really what you're getting. You're just getting a little gadget. Whereas when you go the prescriptive route, you are getting the professional. You're getting regular follow-ups. You're getting the hearing aids tested on a piece of equipment that can measure the exact output. Anything over the counter, you're just guessing. It's just a guess. But with a professional, you're programming it exactly to your hearing loss and making sure that it's working exactly how it's supposed to. Like you said, following up. How are you doing? How are you hearing? How can I make it better for you? And if your hearing does happen to change, you don't need a new set of hearing aids. We can just adjust them.
Just need to reprogram
Exactly.
a little bit.
Got it.
A little bit. Now, is there a specific age? I mean, I know you said when you feel you're starting to lose your hearing or is the time to come, but I mean, and you said males typically about 55 and females a little bit later, but I mean, so there's not, there's no set thing for hearing, right? I mean, like, hey, you should maybe get your ears just proactively checked at 35.
Yeah, I've noticed a trend of people younger and younger coming in just because they want to check their hearing. You get everything else checked. Every so often you get your eyes checked. Every so often you go to your primary care, your blood pressure, your blood work. So younger and younger people are coming in. There's not a specific age, but yes, anytime you have concerns, you should get it checked. But like I said, 55 is what the primary care are starting to be. It's their limit that they're starting.
You know what I kind of like is that the primary care doctors, at least mine is, are really starting to look in a more holistic person as opposed to, okay, you're coming in, let's listen to the heart. Okay, breathe deep, breathe deep, breathe deep. Let me thump on your back. And, they're sitting there looking, they're saying, hey, okay, let me look into your mouth. Okay, well, maybe you need to get some dental work done. Maybe you need to get your hearing checked. Maybe let's look at the eyes. And this is just a general practitioner that said that. I know my dentist was like, wait, a GP suggested you go get dental work done? That's, which I think is great because now you've got professionals that are coming into the medical industry that are, really looking for the whole person, not necessarily, I mean, you may look and say, okay, well, you're not a candidate for me. It'd be really easy to say, okay, well, sorry, have a nice life. I can't help you.
Right.
But yet you're saying that you work with somebody that does the cochlear implants. If that was somebody that was interested or a candidate for that
right,
we can pass off. And I think that's just a really good kudo to the larger medical industry that they seem to be all looking out for one another to be able to, make sure that the person is as healthy as they can be, even outside of their specialty.
Yeah, I would agree also. And I think physicians are paying attention to the connections that we're starting to see in the field. So diabetes, cardiovascular issues like high blood pressure, we're starting to see these connections. The research is coming out showing that these health conditions, which you don't think are in any way associated with audiology, are strongly related to hearing loss. People with certain health conditions, they get hearing loss sooner or it progresses more quickly. So the physicians are recognizing that these conditions that they're addressing actually have to do with audiology as well.
The body is a complex thing. I mean, you look at the Ozempic thing and it's, okay, here it's great for diabetes. Oh, wait, we're losing all sorts of weight now. About that. You talked about younger kids coming in to get their ears checked, and Apple. I'm a big fanboy of Apple, but they have come out with the AirPods, and when I was growing up, we turned the stereo up loud, and the cassette tape and the mixtapes and everything else.
Right.
And that's how we heard, and, your parents were, turn that damn rock and roll down, the whole 9 yards. But today, that's not like that. I mean, you're putting a plug in your ear and you've got a speaker literally inside of your ear at that point. Are you seeing that's causing any kind of a problem? I'm not looking to crap on Apple, but
I mean, it's any headphones. It's not just Apple. So I've preached about hazardous noise that can come from, people think it's things like fireworks or firearms, but it's the headphones and the kids that are an issue. There's a 60-60 rule. So only listen to your device at 60% of the volume for 60 minutes at a time to protect your hearing. But Apple and even Android, they have different features now in their settings where you can limit the output of the device so that it doesn't go too loud. You can limit how loud the child can listen to the headphones. And actually now the Apple AirPods Pro 2, that one specifically, they have an update now where you can use them as like an over-the-counter hearing aid. It's not for someone, again, who would be a candidate for a prescriptive device, but it's maybe someone who has a little bit of trouble in meetings and they just need to pop them in. They only have up to a 6-hour battery life. This is not for someone who needs
to wake up in the morning, pop some ears in and
who needs to hear all day long. It's not for them. It's just someone who might need help. But they also have a hearing protection feature in them now. So as long as they're fit and seated appropriately, they do have some noise cancellation properties. So that is a form of protection.
It's good that the manufacturer are looking to that. I mean, I know that my days back in the bar, I mean, never thought about that. I mean, we were, 40 feet from giant speakers that were blaring out for 5 hours a night. So there was no 60-60. But so you are seeing hearing loss from the headphones and the AirPods, and certainly that's in the younger generation. I mean, typically I don't see a lot of 70-year-olds, jamming with their.
And there's also a lot of service members coming back with noise exposure. So younger and younger people are coming through the door for different reasons. Before you were just thinking, oh, I'm getting older, I need to check my hearing. But, there's a lot of other things in our world that are noisy, military noise and concerts where we're seeing younger people.
How dangerous are concerts without hearing protection?
It depends what concert you're at, how close you're sitting to the speaker. But it only takes one instance of really loud noise to cause damage. So, So you've got to be pretty careful. I just went and did the Trans-Siberian Orchestra for the first time. It was cool, but we had floor seats and it was extremely loud. I had my earplugs in and it was still loud. So probably it might have caused a little bit of damage. Maybe, it's when the next morning you wake up and you have ringing in your ears or things feel muffled. That's a temporary.
That was a good concert.
It was a great concert. You probably had the best time, but that's evidence that there was some damage that might have occurred in that ear that we can't fix. Once it's gone, it's gone.
Really? Okay. And that just, I'm trying to think of an analogy on that. That would just be like a giant piece of, I don't know why licorice just popped in my mind, but, and a little mouse, that's your hearing through your life.
Yeah.
And then just a little mouse for that concert just took a little nibble off the end of it.
Yeah. I think a mouse would be more into a piece of cheese than a pig.
Okay. So it's a big piece of cheese. That's fine.
I'm just giving you a hard time. No, that's actually a really fun analogy. Over time, yes, a little bit more gets taken away or there's a little bit more damage and there's nothing we can do to give it back. We can only work with what's left. That's why I say get tested early on so we can treat you early on so your hearing stays as best as it can be for as long as possible.
So when we get to that one third of the cheese of the licorice is gone, it's gone. And that's when you may start to see and notice on a daily basis, hey, I'm not hearing as well. I'm not understanding as well. I'm not comprehending as well. And
right.
That's
And do you know the tinnitus may actually be a sign? Before you realize you have loss, you may experience the tinnitus first, the ringing in the ears, because sometimes that can pop up before the audiogram shows us a big change in hearing.
interesting.
So if you get any little bits of ringing, go get your hearing tested.
Okay, so earplugs, little foamy things.
They're getting better. There's more and more headphone options or earplug options. I actually use some that are filtered. So that means we're taking down the loud noises, but music can still come through more naturally. So it doesn't feel like you're just blocking up your
So
ear.
you're cutting the 60% volume.
Yeah, exactly. We're turning down the volume, but you're still able to enjoy the sound. It doesn't, you're not missing anything.
It's not a muffled,
Right.
like you're speaking through a sponge
Exactly.
or something like that. Wow. Okay. So that's, and I'm guessing what types of noises are harming us every day. Okay. Obviously the guys that are, over there at BWI directing the jets on the tarmac are wearing, they're exposed to all of that. The people that are performing or working in concerts or going to concerts are getting damaged. But what other areas are there other areas that we need to be concerned about just in going about our day-to-day business that we?
Yeah, I would say number one is the noise from the headphones. That is the modern problem now because everyone is experiencing it. From the young to the 105-year-olds. The music in the headphones is getting louder. It's not restricted as it should be. But there are people who are musicians. I have quite a few patients who are musicians. They're in a band and they don't want to wear the earplugs because they want to hear the music really full, but there are options for them. Some occupations like at BWI, like you said, but there's a lot of people who work in larger factory settings or even people who are in IT who work near servers all day, large, computer
Right.
servers. So it depends on your occupation, but consistently, it doesn't matter where you work, who you are, if you've got the headphones in loud, that's a big issue.
That's the big issue. Best way to protect yourself. I mean, the plugs and 60/60 rule.
That's it. When it comes to noise exposure, it's all preventative. So the plugs, they have, there's custom plugs too. If you're someone who says, well, I wear these, but they don't really fit for my ears. I have really tiny ears, or I have a really interesting shape ear where normal plugs just don't work for me. You can come to an audiologist and they'll make custom plugs for you that can have filters in them, or they can totally plug up. They can be larger, smaller, different colors. Attached to a lanyard if you're someone who has to put them in, take them out all day. So there's a lot of options.
Oh, wow. Interesting. I do say that I'm impressed when I see parents, even though the kids look silly, but when you take like a little 2-year-old at a concert, and they've got the big old, the headphones on to cancel that out. I mean, I'm totally impressed with their parenting capabilities. Although fashionista-wise, I don't know that it looks so good with a kid, but I mean, obviously it's going to be saving them down the line.
Yeah.
To do that. One of the things with my hearing aids was, my vanity. It was like I don't want people to know that I'm not perfect. Wink, wink. Nobody can see the wink in a podcast, but
Yes.
that's a big thing. The vanity and just a stigma of like, how do you deal with that? I imagine your patients come in and will say, gosh, maybe I need them, but I'm okay.
Right. So there's a trend where people feel like, oh, I'm going to look old if I wear these hearing aids.
Yeah,
Everyone's
like,
wearing
well,
those. Yeah, they worry that they look old when they wear hearing aids or that they're going to show. I mean, outside of the hearing aids being relatively small, I tell people, it looks more silly for you to have to ask someone to repeat themselves 3 times than you do having a tiny little hearing aid in your ear when you're able to actively engage in a conversation.
True. And I will say that anybody that has longer hair, if you're a female and have longer hair, it's very easy to hide
Right.
whatever's behind your ear if you go with that route. And, even guys that have just marginally longer hair, it's very difficult to determine if you're wearing something like that. I mean, if you're dead behind somebody, you might know, whatever.
Yes. And of course, I'm out and about. I'm an audiologist, so I see hearing aids everywhere all the time. I'm honed in on.
Or is this like the big spotlights? And so,
It's hard to miss, but most people, if they're not thinking about it, they're blissfully unaware and they're not looking at your ears like that. And even if you don't have long hair, there are hearing aids that go just inside of your canal. You cannot see them at all. So there's so many options. And when you visit your audiologist, they will go through them with you. You can pick the one that works best for you.
I was looking at your website. You are an audiologist, okay? And that is a doctor of audiology.
Correct.
And what separates you from a hearing specialist, which is what like the some of the over-the-counter places would?
Sure. So there is certainly respect for the dispensing community. They do well in what they do, which is hearing aids. Their training is specific to hearing aids and a straightforward hearing loss. So they can be an expert in that way when it comes to hearing aids specifically. The background that they're missing is the heavy diagnostics. So they will often refer out. If something doesn't quite look right on the test, it's not obvious to them, they will refer out to an audiologist and to ENT specialists to figure out what else is going on in the ear. So not everybody just has hearing loss from aging. Some people have issues with the anatomy of their ear. They have something called otosclerosis, for example, which is kind of like when the bone in your middle ear adheres to the cochlea. And so that's not something that they would typically work with.
Oh,
So,
right.
yeah, so that's the difference. There's a difference in training and specialty.
And obviously that whole secondary degree that you got after the
Right. And as I said, there's so many more aspects than just hearing loss to audiology. There's the entire balance system. There's processing disorders. So there's a lot more to audiology than just hearing loss and hearing aids. And so dispensers, they work with straightforward hearing losses and hearing aids, and audiologists have a larger scope.
Makes sense to me.
Mm.
Where's your age group? Where's your sweet spot with your patients age-wise?
Yeah, so I would say most commonly I'm getting people in their late 60s and up. Those are the people who tend to have hearing loss and benefit the most from hearing aids. But I love all my patients, young and old. I will
There's
say
not that one that you really can't stand? Come on, spill the beans. Which one is it?
me never know. Oh, everyone is so no. I am lucky. I have really fantastic patients. They themselves are patient with me. As I'm running it all, I'm taking the calls, I'm dealing with the insurance, I'm giving the patient care. So I have really fantastic patients. I do.
What's the lifespan of the hearing aid?
5 to 6 years reliably, I would say. I mean, I've also held a 19-year-old hearing aid in my hand that was
Okay.
functioning well.
Strapped on in a box on your hip with the headphones in.
Right, right. But I mean, you want to be getting new technology after that 5 or 6 year mark, because that's when you start to see the leaps and bounds between technology level. Maybe 1 year to the next, you're not seeing as much of a difference, but if you got hearing aids right now in 4 years, you know how quickly technology, you're going to see big changes in how it functions. So, yeah, I would say 5 to 6 years reliably. Once they're out of warranty, which is usually after 3 years, the repairs get more expensive as the hearing aid gets older as well.
Sure, they're not supporting it, and the parts are
They become obsolete, yes, harder to work with. But again, it's nice to have the new technology. You're going to benefit from, and usually the technology has to do with how well they process speech and noise.
Okay, so it's a market improvement.
Correct.
So I'm aiming as I trade up to my next set, it's gonna be like, wow, okay, this is
Right.
something much different than what I've experienced.
Yeah, prescriptive hearing aids, they have computer chips in them. And so computer chips become more advanced. They become faster and smaller. So your hearing aid becomes faster, more efficient, and smaller. That's why they're nearly, invisible these days.
But the AI, man, the next time I'm going to dial up and say, hey, I want to hear the Taylor Swift concert.
Oh, it's amazing. They transcribe and they can translate languages for you now. Some of them.
Well, I mean, I know that the UN has always had those headphones where somebody's talking and there's some kind of a transcription going on. I always thought that was just somebody talking, but hearing aids can now do that?
They can do that with in conjunction with an app on your phone. They also have fall detection. So if you have a loved one who tends to fall but lives at home, you can set it up so if you fall, the hearing aid detects it and sends a signal to your loved one that you've hooked up to the feature. It's really cool.
Okay, what else? So is there any other cool stuff that's in the development in today's hearing aids? That's mind-blowing to me. I know you've got the fall detection on the watches and the phones and everything else and crash detections, but that means that you got to have your phone or your watch on you.
Right. Yeah. The other cool stuff I think is more audiologist specific, something that might be, really cool to me, but it might jazz me, but you might not worry too much. Like they can detect motion when you're walking, so it changes how it processes. If you're on a walk with someone, it functions differently than if you were seated at a table in a restaurant. So there's little things like that, but the idea is that your hearing again, like your physicians, whole person, whole health. It's not just your hearing loss, it's your whole body that we're taking care of and protecting.
Interesting. If you were a techie person inventing hearing aids with your audiology background, could you look into a crystal ball and say, what would a hearing aid in 2034 be? Or what would you like to see in a 2034 hearing aid?
Yeah. So, I mean, ideally in 10 years from now, we would love to have something that could cure hearing loss. But with that not being so likely, what everyone's looking for in a hearing aid, what everyone's asking for when they come through the door is the best possible hearing, especially in background noise and, not so visible. So continue to get smaller and faster, but it's background noise is the number one complaint. So it's the sound quality, whether it's tomorrow, last year, or in 10 years, it's always a sound quality that we're going to be looking for better. Because as your hearing loss, degrades and your nerve degrades and it's harder and harder to hear in background noise. Again, we can't fix what's wrong in the ear. We can only work with what you have left. And background noise is the number one complaint.
I would venture to say they are. I mean, you want to concentrate on what the task at hand as opposed to whatever else is going on around in the restaurant or the football game or whatever it may be. For those that are subject or suffering or think they're suffering, personally, I can tell you there's help. Certainly, Dr. Ometz can tell us that there's plenty of help. There's plenty of opportunities to regain a lot of what you may have lost. And there's invisible options. There's not so invisible options. I can say that nobody's judging you for having a little thing hanging in your ear if they can see it at all.
That's right.
And, if you're thinking, get it checked. And again, Anne Arundel Audiology.com. They're up here at 1600 Crane Highway South. Is that the address?
That's right.
In the Crane Towers. And it's quick shot up from Annapolis, and Glen Burnie makes it real easy. West County, it's very easy. 97 makes it real easy to get here, and check it out and see if something would be here. But I want to thank you so much for inviting me up, and I'm loving your office, watching the planes go by outside the window, and congratulations on the relatively new practice. So
thank you so much. Thanks for having me too. I appreciate it.
Thanks for listening to this week's Local Business Spotlight. Please make sure to visit eyeonannapolis.net for all your local news, events, and opinion. And in case you haven't already, please subscribe to the Eye on Annapolis Daily News Brief, where we bring you all the day's local news direct to your phone, tablet, or computer in about 10 minutes. It comes to you at 6 a.m. every Monday through Friday, and you can subscribe on Apple Podcasts, Google Podcasts, or wherever you get your podcasts.